for the measures that we've actually adopted, starting with the lockdown on the 24th March.
India is at the war footing, though under lockdown mode, but dealing with it. And most importantly, the measures taken by our Prime Minister Narendra Modi were timely and decisive.
Hello, you're watching DD News and I'm Preeti presenting this special edition of COVID-19 Doctors Speak. Mark Twain had said that a lie can travel halfway around the world when a truth is still putting on its shoes. Now, this is the enormity of a lie and a rumor. We get to this special edition each day wherein you can ask your questions and your doubts to the doctors. You can also ask questions on the numbers that will be flashed on your screens in a bit from now. Also, you can put your questions on our Twitter handle and also on our Facebook page as well. Please ensure that the audio of your television sets is on low mode when you ask the questions. Today we're joined in by an esteemed panel. We're joined in by Dr. M.K. Sen. He is the Chief Nodal Officer, COVID-19 Safdarjung Hospital. We're also joined in by Dr. Aparna Agrawal, Director Professor, Department of Medicine, Lady Hardinge Medical College. And through Zoom, we are joined in by Professor Rohit Gupta, Director, Institute of Critical Care, Mount Sinai Hospital, New York. And when we talk of the questions, make sure that the audio of your television sets is on the low mode and you can put questions to our doctors, your queries, your doubts, your rumors, myths on the numbers that are being flashed on your screens. Dr. Sen, when we talk of the current situation, the latest data which has been put forth by the Ministry of Health and Family Welfare, the country has 19,868 active cases of COVID-19. But from 8 a.m. Friday till 8 a.m. Saturday, India recorded 6% growth in the new cases, which is the lowest daily growth recorded since India recorded 100 cases. To begin with, how would you gauge and how would you evaluate how has been the fight against COVID-19 put forth by the government, put forth by the country till now? Just one more week of lockdown is left. So how would you evaluate the current scenario in the country?
See, as you have rightly pointed out, the figures speak volumes.
Yes.
So we know that thanks to the proactive and the very timely adoption of the measures by the government, we have reaped the benefits. So if we compare our figures with those from the Western world or maybe many other countries, we find that although we have quite a few cases, the numbers are significantly lower. And they're probably much lower than have been the predictions, although predictions have their own limitations. So there is no doubt about the fact that the timely measures that have been adopted, mainly the lockdown and several other measures that we have in place right now, have shown results.
All right, Dr. Agrawal, when we talk of the symptoms, now there are numerous cases of how people have recovered and how they have made recoveries. Now, when we talk of the foremost concern of the patients, what is it? Because there is hesitation, there is skepticism still related to the disease. Why is it that people are still not comfortable with coming out and accepting that they could have the symptoms?
I think one of the main reasons is the fear of quarantine, the fear of isolation. So there are many, even amongst the health professionals, we are there in the front, fighting as frontline warriors.
Yes.
But still, there is a fear at the back of our minds that if we get infected, then it means isolation. After exposure, it means quarantine for some period, and the fear of infecting our near and dear ones. So that is the major thing which is there. So all of us are fighting, all of us are going for our duties, we are doing everything, but that fear is there, I think, mainly because of quarantine and this. The second important thing is that we don't have a definitive treatment for it. So we are treating it symptomatically. There are few things which are promising. Many drugs which initially appeared a little promising have now not failed the test of time. So I think these are the two things which are making people still skeptical and not wanting to accept it or wishing that they do not get this?
All right, you're talking of medication, you're talking of treatment, ma'am, but then there are questions, there are doubts in the minds of the people that when a vaccine is not available for a particular disease, when a vaccine is not available for COVID-19, what sort of medication is being given to those people who are suffering from it? Dr. Sen?
Well, the first thing that I would like to tell the viewers is the majority of the patients who present with COVID-19 have very minor illness or very few symptoms. They have symptoms like, runny nose, sore throat, maybe some mild fever, and which lasts for a few days and then subsides. And I would say 80% or even more would have this sort of a presentation. So it's in a very small percentage that patients really need, medical care, which is, and in a maybe less than 5% would go on to the, worrisome state of critical care medicine scenario where they would need ventilatory support. So the first challenge that we have to fight against is allaying the anxiety. Whenever a patient steps into the hospital, whenever he tests positive, so under the current scenario, he or she has to be in a hospital facility, so or a COVID care center facility. So whenever he walks into the facility, the first thing that one needs to do is allay his anxiety and explain to him the situation that majority of the patients have really gone back home with healthy minds and healthy bodies, so they need not be be afraid. So once that is over, then what needs to be done is symptomatic management of whatever his presentation is. If he's asymptomatic, we need not give anything. But if he has symptoms of fever, then we treat him for his fever. If he has symptoms of soreness of throat or a stuffy nose, we give him medication for that. And the most importantly, when he is in the healthcare center admitted with us, he is monitored daily, and he is monitored very closely for lest he deteriorates. So God forbid if he deteriorates, then he's shifted to a critical care scenario. So as I told you, the most important thing that a patient requires is allaying of anxiety, and next obviously would be symptomatic management and close monitoring of his clinical condition.
All right, at this point we're getting questions on our social media pages. I'll put the question. It says, is there any chance that blood donated by asymptomatic COVID-19 person will affect another person or patients to whom the blood will be given? Added to this, what special care has to be taken while collecting blood from the donors? Dr. Agarwal?
So while collecting blood, till now we have not established that infection occurs through blood. There's been 1 or 2 reports of possible viremia transmitting the infection, but it is not very definite. So we need to check, even if virus is present, whether it causes infection in the other person or not, it is not very certain. So right now, patients who are totally asymptomatic, for them it is not a must to test for coronavirus infection and to test for antibodies in them at the present moment.
All right, the next, yes. Okay, the next question we get on our screens is that, is normal water hand wash enough for coronavirus? Dr. Sen?
Yes, hand washing, as we all know, and has been repeatedly being, through the print and the electronic media being publicized, hand washing is one of the most important steps that one has to undertake. And while washing hands, we must remember that it has to be running water, of course clean water, and we should have adequate soap, and we should wash all aspects of our hands, including the interdigital clefts, the fingertips, the wrists. There is a method, and we should use at least 20 seconds, if not more, while we clean our hands and wrists. And this should be done frequently, particularly if we come into contact with any open surface, like if I touch a table or a doorknob or a switch, I should obviously take into account that I wash my hands, and it should be clean water and soap.
All right, from here, as we've told our viewers, that we're also joined in by Dr. Rohit Gupta. He's joining us through Zoom. and he is Director, Institute of Critical Care, Mount Sinai Hospital, New York. Thank you so much, Doctor, for joining us this afternoon on Dr. Speak COVID-19. You're there in New York, and we've seen how the cases have shot up in United States, and the number of deaths has multiplied there in the United States. When we talk of the prime concern here in India, there is the lockdown that is being followed. You are there in the US. I would want you to first understand from you what is the current situation there in New York.
Hi, good morning, and thank you for having me on the show. As you mentioned, United States and New York in particular has been through a lot over the last 4 weeks. And I think I'd like to start by commenting on how people have followed instructions in India and really managed to keep things under control. For New York and the United States, what we're seeing is that the peak number of cases was reached by April 15th. And we're slowly starting to see a stabilization in the number of cases. And just like the rest of the world, what we're seeing is that different parts of the country are at different places in time with regards to the epidemic. So with New York in particular, we're seeing that we're starting to look at the beginning of the decline, whereas in certain other parts, we're still looking at an increase in number of cases.
All right, Dr. Sen, when we talk of the next question, which has been put forth by one of our viewers, is how to trace the most vulnerable cases of COVID-19 during the lockdown, which has been put forth by the government. Now, when we talk of the challenges for the government, you yourself as the nodal officer for COVID-19 at Safdarjung Hospital, what are the challenges? Because on one hand, tackling the rising numbers, the threat of the pandemic. On the other hand, as we opened the show with the hesitation of the people, we've seen people running away from isolation centers, we've seen people hiding travel histories. So basically dealing with the psyche, added to that also the overall anxiety, the overall pressure of working in such times. So how would you deal with, how tough is the challenge at the hands of the government at present to put all this together?
So that's a wonderful question. I think today we don't have any dearth of infrastructure or manpower or equipment. So the major challenge we face is perhaps, as was pointed out at the beginning of this show, is the anxiety in the minds of the common man as to the nature of the disease. As the name suggests, it's a novel virus, and things are still evolving as to what would be the behavior of the virus in terms of the morbidity and the mortality. But by and large, what has been observed is that majority of the patients would have a minor illness, sort of a disease, and they would require facility isolation once they are detected to be positive. And of course, we have to treat them symptomatically, and as and when, if we have to monitor them, and as and when they require medical care, which whatever is the appropriate medical care has to be administered. So your question pertains to the vulnerable sections of the community.
Yes.
So it is common knowledge that the population which is at risk is obviously the ones who are elderly, who are aged 65 maybe or above, who have comorbid conditions like if they have high blood sugar or diabetes, or who have hypertension or other cardiovascular diseases. And of course, another very important section of the community is the healthcare worker. So the healthcare worker, the frontline healthcare worker who is working night and day with the in close proximity with the patients. So we have the vulnerable sections of the community also includes young children, maybe pregnant mothers. So these are the sections which have to be taken care of, and one should be always, the community at large should be particularly careful about social distancing, hand washing, use of masks, respiratory etiquette, and coughing into
Yes.
a tissue paper and discarding it into a closed waste paper bin or a handkerchief, or using an elbow. So all these common things, which is common knowledge by now, should be meticulously and religiously followed. So
Yes.
one should realize that although they may seem to be very insignificant, these are the tools which ultimately are of maximal benefit in prevention of the disease.
Yes, prevention is the most important word here, and that is the only way by which we can keep ourselves safe and also our near and dear ones. A quick reminder to our viewers, you are getting the numbers being flashed on your screens. You can ask your questions to our doctors who have joined us on Doctor Speak today, and also we have our Facebook page where you can put your questions. Also, in reply to the pinned tweet on our Twitter handle, that is DD News Live, you can put your questions, which will be answered, which will be taken up by our doctors. Going across to our doctor who's joining us from US, Dr. Gupta, we have this question coming in. He says, I am having tonsillitis for more than 10 days now. Is it normal infection or anything, or should I seek for a COVID-19 test? How do you respond to it, sir?
So I think one thing that we have to understand is that COVID-19 infections can seem to resemble other infections that you commonly get. It's similar to the flu in that you can feel symptoms of a sore throat, a cough, a fever, and similar to that you could experience pain and sore throat from tonsillitis. I think for your speaker or for the caller who's calling with the question, I would say that if these symptoms persist, where the breathing troubles are getting worse or the fever is getting worse, then they should come in to get it checked out to make sure that it's not dealing with something more than just a regular flu.
All right, another question which is which we've seen is of concern for people, Dr. Agarwal, is what precautions we need to take at home. Do we need to wear masks at home is one part of the question. Added to that, how do we take care of the vegetables and the fruits, the groceries which we bring from outside? For how long do they need to be washed, and how long can the virus survive on the things which we are brought from outside?
Okay. The first part, if everybody is home, all the people in the house remain inside, then there's no need to wear a mask in the house. If there's somebody who's going out for work, like the frontline workers, then maybe the elderly can wear a mask and be in the house. But social distancing should be maintained with the elderly in the house, and the person who's going out for work needs to maintain proper hygiene and protocols, that once he comes back, first take a bath and then get in touch with others. Wash your clothes, remove your mask, keep your footwear outside. All these things should be followed properly. But if everybody is staying in the house, then I think there's no need to wear a mask inside the house. So that should be okay. The second part of the question was?
Yes, and how do we wash the vegetables, the groceries which we've brought from outside, and for how long can a virus survive on the things which we bring from outside?
Okay. We cannot say for definite for how long the virus can survive on these things, because there are different studies, they're all small studies which have reported varying time periods for which the virus can survive. But all vegetables, it is imperative that we wash it properly in running water, leave it for a few hours to dry, and then put it inside. So that is important for all vegetables and fruits. We can wash it immediately after that, let it dry for some time, and then put it inside. The second thing for groceries, for all packets which come in sealed plastic covers or in metal containers or plastic containers which can be washed, it will be a good idea to wash all these, let it dry, and then put them inside. For other things, we can leave it out for some time, maybe a day or so. Now, as I said earlier, that we don't know for definite, but possibly it is a few hours that the virus survives, because different studies have been conducted under different temperatures, different percentage of humidity, environmental humidity, and wind speeds. So we cannot take it for granted as to which study is right and which is not.
All right, going across to this viewer who puts this question on the range of temperature in which the virus can thrive. Now, there is a lot of doubt on can actually, progress towards hot conditions lead to killing of the virus by itself. Taking a hot bath, can it prevent the new COVID-19 is another question which has been put forth by one of our viewers. And also added to this, again, the opposite of this question would be, does cold temperature lead to thriving of the COVID-19 virus? Dr. Gupta?
So I think those are great questions, and I think it comes down to what are the conditions that make the virus more infectious or less infectious. I think a lot of this is still under review. We've had different studies that have shown, as your other speaker mentioned, that depending on the study, you have different temperatures and different conditions which affect the virus's survivability. What we've seen with other viruses is that they've shown to have a seasonal nature where infections spike or go up in the winter months and then settle down in the summertime. We have to be careful as we are learning more and more about the coronavirus to see whether it does have a seasonal nature or not. In our experience and what we see from across the world, with ambient temperature, whether it's between 25 to 35 degrees Celsius, we've still had transmission of cases. So I think from the perspective of seeing whether this virus can survive and infect, I think what we have to assume and carry forward is that it's a possibility that will continue, regardless of what the actual temperature at which we can manage it or control the infection.
All right. For our viewers, this show is from 2 to 3 p.m. Our phone lines are open from 2 to 3 p.m. You can ask the questions which are being flashed on the numbers that are being flashed on the screens. Going across to our doctor. Dr. Sen, one of our viewers puts this question as to how accurate and how effective is the screening which is done by the thermometers, in the sense how important and effective is thermal screening? One point, because if a person, the window for these symptoms to get confirmed is around 14 to 15 days. So if a person is not detected as symptomatic by thermal screening, is that accurate enough? Does that mean that the person does not have the virus, given the fact that the virus, the symptoms of the virus will be confirmed in the next 14 to 15 days?
Yeah, coming to the first point, thermal screening uses an instrument which is a non-contact thermometer, whereby the temperature is recorded. Now, as you have rightly said, fever is just one of the symptoms of this disease, and there may be many patients who are asymptomatic or pre-symptomatic who do not have fever, who would be missed if we are doing thermal screening. But let me tell you that as the name suggests, screening is for conditions, for mass screening is utilized in places like airports or entry points to public places where you would like to screen out at least those patients, those people who are having fever. But then an additional point would be a questionnaire. For instance, let me tell you, when we were screening passengers coming in from abroad at the airports, every passenger was handed over a questionnaire where he would be self-declaring his symptoms, which included anything from body aches, headaches, or runny nose, and then this would also be a part of the screening. So thermometers would definitely pick up those patients who present with fever. But as we know that pre-symptomatic and asymptomatic patients would not be having any symptoms, and still they would be having, shedding viruses. So those are the sections which would not be picked up by thermal screening. That's a limitation. But by and large, it has been seen that fever screening method is very effective as far as screening is concerned.
Today also in his Man Ki Baat address, the Prime Minister talked of the precautions. He appreciated the people who are abiding by the lockdown guidelines, but he also talked of the ways which have been already highlighted by the government to boost the immunity. And he also talked of having hot water. He also talked of having kada. Now, there are doubts which are coming up, which say that regularly gargling with salt water or saline can help prevent infection, can it or not? And also drinking water to flush the virus out from your mouth and your system. Put these together, Dr. Gupta, how do you address this? When we talk of gargling, can we gargle with hot water? That's it? Is that more than enough?
So I think one important aspect that we should understand is that till date, there has been no approved treatment that can either treat or prevent coronavirus. I think we have to be very careful when we look at specific treatments to treat the infection. Oftentimes, one might think that because one of the symptoms is sore throat, maybe using warm water or hot water to gargle might help treat the infection. It will certainly help with the symptom of the sore throat, but I think we have to be careful not to mix up the relief from the symptom versus relief from the disease itself. Your other point mentioned drinking water. Drinking water is always recommended as just a means of keeping yourself hydrated, especially if you do have an infection, including coronavirus. Patients tend to have high fever sometimes, and that can lead to a sense of dehydration. So drinking water in itself, again, helps with symptoms, but I think we have to be careful before we start labeling any of these as a silver bullet to treat this disease.
All right, we have our question coming in from one of our viewers. Mr. Anup Basani is joining us from Mumbai. Good afternoon, Mr. Anup. Please ask the question.
Good afternoon. I'm an SLE patient.
Yes, ma'am, please continue.
And I'm taking HCQ from 1.5 years, and I'm taking steroids also. So,
yes.
What chances of me getting this COVID-19?
Dr. Sen, would you address this question? Asthmatic patient?
No, SLE.
No, this is a patient. I believe, ma'am, you are suffering from systemic lupus. Systemic lupus erythematosus, for which your rheumatologist has prescribed.
Disease.
Yeah, it's an autoimmune disease, and for which your rheumatologist has prescribed hydroxychloroquine sulfate and corticosteroids.
Omnicortin.
Yes. So in order that your disease stays in remission, it is essential that you should be in regular consultation with your clinician, continue with your regular medication. As far as the question which pertains to today's discussion goes, is whether HCQS would protect somebody who is exposed to such conditions. Well, the answer would be, at the moment, the recommendation for HCQS is only for the frontline health workers who are taking care of patients who are COVID-19 patients, and this is to be taken in a particular dosage every week. And as far as the general population is concerned, there is no recommendation as yet for HCQS medication as a prophylaxis. And the other area where HCQS could be used is those who are afflicted with the disease. Of course, that is with those patients who are seriously ill, and in the hospital scenario, that's for the doctors to decide as to when to use it as a therapy. But for prophylaxis, at the moment, we are only using it for frontline healthcare workers who are exposed to a large viral burden, who are exposed to procedures like nebulization or tracheostomy, bronchoscopy, suctioning, or intensive care, looking after those patients who are shedding the virus constantly. And this is in addition to the personal protective equipment that has to be strictly followed. These are guidelines that are in place today.
All right, from here we are getting another question on our other social media platforms. Ma'am, one of the question is that how can we deal with asymptomatic patients? How can the family members of such patients come to know that they are living amidst a COVID-19 patient?
Nobody can know that. Only thing is that we need to find out if the person has traveled anywhere and has been in touch or in contact with anybody who has had an infection. In that scenario, we have to be careful and maintain social distancing. And if you have come in contact with anybody who is infected or may have been infected, then the recommendation is self-quarantine of that person. So otherwise, there is no way by which we can know about asymptomatic individuals. As yet, we have said that we do not have community transmission. So it is unlikely that if you are at home, then you will get this. So if you have been moving out, then chance may be there if you have come in contact with somebody.
All right, from here we get the next question from our caller. He is Mr. Harish, joining us from Dwarka. Good afternoon, Mr. Harish. Please ask your question.
Good afternoon, ma'am. Good afternoon, doctors. I have a question that I am 48 years old. I am diabetic, controlled diabetic. I am taking Voglibos 0.2 mg and metformin 500 mg twice daily. And also I am taking 5 mg of amlodipine. I have no fever. I am in home since 26th of March. But sometimes I feel that I have a feeling of the cough, but it never comes out. Only it's a feeling. So I'm a little bit concerned. Does it related to COVID or what it is? But I never cough. Even I can do pranayama, I'm doing exercises. But this feeling of cough in the middle of my chest gives me a feeling of worry.
All right, Dr. Sen, a diabetic patient there, concerned for his cough.
Okay. You are 48, you said, and you have diabetes. So I'm sure your diabetes status is under control and you are constantly in touch with the clinician who is looking after you. So that's for sure that your diabetes should be under control. The second thing would be that I'm again very sure that you are taking care of the personal protection, which includes social distancing, use of a mask, and hand washing, and so on and so forth. As far as your cough is concerned, if you are not a smoker and if you do not have any chronic respiratory illness and your cough is persisting for how many days did you say? Was it more than 15 days? Then I suggest you get in touch with your clinician and sort it out. I'm sure it would not be the the answer to the questions whether you have been in contact with somebody who has traveled abroad or who has been a COVID positive patient. The answer would be no. But still, since your cough is bothering you, you should get in touch with your clinician, and there can be many reasons why a diabetic who is under control, well-controlled diabetic develops cough. So if you're a non-smoker and you have cough lasting for more than 15 days, you should at least get yourself a consultation with your clinician to seek a remedy for your cough, which is definitely a non-COVID cough, but still you should get in touch with your clinician as to how to seek a consultation with the clinician for the remedy for your cough.
All right, let's take this thought forward to Dr. Gupta. Dr. Gupta, we're talking of the symptoms here. Now, the initial symptoms for COVID-19 are flu-like symptoms, headache, cough, running nose. One of our viewers asks us that can the medicine for pneumonia, how far could it be effective in dealing with COVID-19? Added to that, there is a specific question pertaining to a medicine. The person asks, why not use this medicine, nivolumab immunotherapy? So how would you deal with this question?
Thank you for that. So with regards to the treatment for COVID, as we discussed earlier, there are a number of trial drugs that are being tested out. Some of these treatments are looking to directly fight the virus, and some of the treatments are looking to modulate or control the inflammation that the virus is causing. With regards to your first question, typically when we talk about treatment for pneumonia, what we're talking about is the treatment for a bacterial infection, which is usually antibiotics. And what we found is that antibiotics by themselves have no role or impact on the treatment of a virus. There can be certain instances where on top of the viral infection from the COVID-19 disease, you can have a secondary bacterial infection. That would be the only situation where pneumonia treatments or antibiotics could be effective. So to answer your viewer's question, I would not recommend that anyone try pneumonia treatments as a first line to treat COVID-19. With regards to nivolumab, as I mentioned, there are a couple of trials that are happening. We're looking at antiviral agents, including remdesivir. Some of your viewers might be familiar with that name, with some previously known drugs like ritonavir, and also with immune agents to try and see what works. I think at this point, we have not seen one agent that has worked effectively across different patients and different populations and different demographics. So I think there's still a lot of studies going on. And I think with everyone's focus on this, we should start to see what agents are effective in which population. But at this point in time, we do not have a clear-cut answer to what's the most effective treatment.
All right, we'll go across to Dr. Agarwal in the studio. Ma'am, we were talking of how to wash fruits and vegetables, and also we have questions coming in which ask about the usage of garlic. How far does that help or not help in preventing COVID-19? Added to this, does microwaving at a certain level and power and maintaining the circumstances, does it kill the novel coronavirus is another question we are getting.
Regarding the first question, washing, we have already said.
Yes.
Simple running water is good enough. If you want to be extra careful, you can add a little soda to the water and then wash it in that. So dip it in that vegetables and then wash it in running water. So that can be done. Now regarding microwaving, fruits and vegetables have to be washed properly. That is extremely important. Having said that, a certain temperature, if we go above 60 to 70, it does kill the virus if it is there for some time. In microwave, we do heat the food substances that we are using, so that should help. But usually we don't microwave for that long. So boiling for 15 minutes is what is recommended for your masks and other things. We don't do that. Cooking food at 70 degrees centigrade for a few minutes is good enough. So I think that should answer your question. But we do take salads and fruits without cooking, without heating. If they're washed properly, they can be taken.
All right, we'll go across to Dr. Sen. Dr. Sen, as the nodal officer for COVID-19 at Safdarjung Hospital, how is the government dealing with the asymptomatic cases? Now, somebody who comes out and talks of the symptoms, who has the symptoms, is easier to deal with because this is the person who has to be given the treatment. But the challenge is of a greater magnitude when it comes to asymptomatic patients. How is the government dealing with the asymptomatic cases? And also, does it mean that they do not have any symptom at all, not even fever, cough or anything else? Or is it that they show mild symptoms is another question put forth by one of our viewers.
Yeah, that's a very important question you've asked. See, anybody who comes to the hospital seeking for medical opinion would obviously be having symptoms. After all, it is only that because he is having symptoms, he visits the healthcare facility. But then there is the large magnitude in the community who do not have any symptoms. So either they are totally asymptomatic or they are pre-symptomatic. By pre-symptomatic is meant the phase where the person is not actually having any symptoms, but eventually, in maybe a few days, he would present to the facility with some symptoms. So the asymptomatic and the pre-symptomatic persons who are there in the community and who may be shedding their virus, is definitely a major problem, and the government is seized with this problem and is taking adequate measures. So one of the things is that we have the basic tenets of social distancing and cough etiquette and hand washing. They take care of this problem in the sense that, I'll give you an example. If we visit a grocery store and we find that there is a queue of the customers, and then everybody must mandatorily observe the rule. The rule is that the distance between any two customers would be at least 1 meter. So why is it that so? There is a scientific basis. So even if the patient is, the person is asymptomatic and he is shedding his virus, A, he would have to use a mask or cover his face and mouth, his nose and mouth. B, even if he is shedding the virus, these particles are droplets which are somewhere between more than 5 microns. So they are they're 30 microns or 40 microns or 20 microns. So being heavy in nature, they would not travel beyond maybe 3 feet. That's the consensus. So eventually, over a distance of maybe a radius of 3 feet or 1 meter, they would drop down, and the person who is standing in the queue behind him would not be actually breathing in those viral particles. So that is a very important measure that has been the basis of social distancing. So the question, coming to your question, asymptomatic and pre-symptomatic persons would obviously cut down the infective potential by observing these rules, which are simple and at times insignificant. The other thing that is also in the mind is, identifying those areas which are containment zones or hot zones where more than a certain number of people have been detected to be residing within close proximity to each other. So those are the zones where the measures have to be, upped. I mean, the government is taking measures to see that strict, adherence to these social distancing is actually being carried out, and it is being followed, very closely.
Yes.
So these are some of the things that are coming up, and then of course there's testing of extensive testing is taking place to see what is the percentage of patients who have developed antibodies and have actually been asymptomatic and developed antibodies. The antibodies develop after maybe 3 weeks, 21 days or more, and that is one way, another method of finding out how these patients have behaved. So there are adequate steps being taken up by the government for detection of asymptomatic and pre-symptomatic individuals and ensuring that they do not pose any significant risk to the populace at large.
All right, we're joined in by one of our callers. He says he's Mr. Ashish, joining us from Kanpur. Welcome to the show, Mr. Ashish. Please ask the question.
Good afternoon, ma'am.
Good afternoon.
मैम मुझे जो है 3 दिनों से चेस्ट पेन हो रहा है लेफ्ट साइड से, और मैम लिटिल बिट जो है मेरे थ्रोट में खराश भी है. बाकी मुझे कोई फीवर वगैरह तो है नहीं, तो इसलिए मैंने आपका प्रोग्राम देख रहा था तो मैंने नंबर लगाया. मैंने कहा सर से पूछ लें कि क्या ये कोरोना जैसे या इस टाइप की तो कोई दिक्कत तो नहीं है.
डॉक्टर अग्रवाल, would you take that question?
आप लॉकडाउन पीरियड में पूरे टाइम घर पे ही हैं या बाहर भी जाते हैं?
मैम एक्चुअली मैं सब्जी वगैरह या ये सब के लिए तो जाना पड़ता है, बाकी घर में ही रहते हैं मैम.
और आपका एरिया ग्रीन जोन है, रेड जोन है, कंटेनमेंट एरिया है?
मैम अभी जस्ट 1 हफ्ते पहले ये हॉट स्पॉट अनाउंसमेंट हुई है, तब से तो सारा लॉकडाउन ही है.
अगर हॉटस्पॉट है आपका एरिया और अगर गले में खराश है, ये है, तो आप हेल्पलाइन को कांटेक्ट करिए और वो आपको बताएंगे कि आगे क्या करना है, आपके डिटेल्स पूछ करके, क्योंकि आपके घर के कितने पास में कोई पेशेंट है जो पॉजिटिव पेशेंट है, वो सब चीजें देख करके आपको बताएंगे. बट अगर आपका एरिया हॉटस्पॉट वाला है तो डेफिनेटली आपको हेल्पलाइन में से कांटेक्ट करना चाहिए.
All right, so we're joined in by other caller. He is Mr. Ramkrishna. He is joining us from Udupi. Welcome, Mr. Ramkrishna. Please ask the question.
See, I am Dr. Ramakrishna, dermatologist. I want to know whether coronavirus can enter intact skin, or the way of entry is only through the mucous membrane and conjunctiva. So I want to clarify about this point.
All right, Dr. Gupta, would you take this question? Transmission of coronavirus?
Right. To Dr. Ramakrishna's point, what we know from everything that we studied up till now is that the main way for transmission and the main way for someone to get infected is for them to take in either the droplets or the virus after contact with the surface through the mucous membranes, whether that's through the mouth or through the nose. That's the main contact. There is concern also that if you touch your eyes and it spreads through the conjunctiva, it can spread further on. I think on a more practical level, what we find is that even if you don't directly inhale it, but say you touch a surface that's infected with droplets from a patient around you, and then you touch those hands onto your face, you don't have to necessarily put it inside your mouth or your nose, but the fact that you're touching your skin on the face can then eventually lead to transmission. But to his question, the answer would be that the only direct way of getting the infection is through the respiratory tract, which is through the mouth or the nose.
All right, Dr. Sen, when we talk of the treatment, plasma therapy is what people are still coming to terms with. I would want you to first apprise our viewers and let us understand through you what is plasma therapy.
Okay. Plasma therapy, what it means is, let me first tell you that it is nothing very new. It has been used in the past, even in the flu epidemic. Plasma is a component of blood. And when somebody who has already suffered from COVID-19 and has recovered, he or she develops antibodies against the virus. Now, there are two types of antibodies. The immediate response is with IgM or immunoglobulin M antibodies. And after a few days, maybe about 3 weeks or more, he develops the immunoglobulin G or the IgG antibodies. Now, these antibodies, as the name suggests, are soldiers which counter the virus. Now, the patient who has already recovered and has developed the immunoglobulin G in his blood is first tested whether he or she has developed adequate concentration of the immunoglobulin G, and if he has, by a process of plasmapheresis, which entails the separation of that component of blood, which is plasma, a small part of his, a wee bit of his plasma is actually taken out, and this, let me assure you, would not harm this patient who has recovered. And this plasma which is taken out from the person who has recovered is utilized, it is infused into another patient who is currently suffering from serious illness due to COVID-19. So a person who is, say, critically ill and he is dependent on life support and is, not responding very well, can be infused the plasma that is obtained from the earlier patient who is already recovered. And it has been seen in some studies, particularly from China. There is a report of 10 patients who were gravely ill and who were, after being infused with plasma from convalescent plasma, we call it, that is plasma derived from the persons who have already healed, they have been seen to recover. So this has been an observation. So there are other, small studies which have also shown that quite a few patients who have been infused with the convalescent plasma from individuals who have earlier suffered from this disease have been shown to, improve. They have, their oxygen requirements have come down, their severity scale of their illness has come down, and they have recovered faster. So this is the premise, this is the basis on which convalescent plasma therapy is used. In our country, the Indian Council of Medical Research and the Drug Controllers General have permitted some of the institutions to conduct a trial, which is currently underway, where plasma therapy is being utilized.
All right. Now, the center of the plasma therapy is, the crux is that the person from whom the plasma is taken should have recovered. I would want you to apprise us as to what are the parameters of recovery. If a person recovers, that means for the next 14 to 15 days, the person does not develop the symptoms of COVID-19 again, which means that he's tested negative. 1 point. Secondly, are there chances of the same person, the recovered person, getting the virus again? Because we've seen WHO has also talked of how the country should not issue health passports to those who've recovered. Chile has talked of giving health passports to people who have recovered, which the WHO has asked such countries to abstain. So put all this together, I would want you to explain to us what does it mean when a person has fully recovered, and can the virus come again to the person who's recovered? Yes, Dr. Sen?
Yeah. So the first question is, what are the parameters to define recovery? So under the current guidelines, once the patient tests positive, he has to be in a facility. At least in our country, he has to be in a facility. And he has to be in the facility. His condition is monitored. For instance, majority of the patients would have cough and fever, which subsides in maybe 3, 4, 5 days, but still he has to be in the hospital for a period of around 14 days, at the end of which, if he is without any symptoms, mind you, without any symptoms includes fever, cough, body ache, headache, or diarrhea, or anything of that sort. In case he doesn't have any symptoms, he's tested. He's tested once again, not once but twice, at an interval of 24 hours. So maybe on the 14th day and on the 15th day, he's tested again. And if both the tests are negative, only in that case, if both the tests are negative at an interval of 24 hours and the patient does not have any symptoms, he may be discharged home. But with the advice that he or she has to stay at home under isolation. So he has to observe the rules of home isolation for a further period of 14 days. So that makes it, say for instance, he has been in the hospital for 14 days. Once he's discharged, he goes back home and maintains his social isolation for another 14 days. So at the end of 28 days, maybe he is declared cured or recovered. Now, the second part of the question is that, the guidelines about issuance of passports, or, whether he can get a second episode of the disease. Now, let me first tell you that the disease, as the name suggests, it's a novel virus. So our experience with this particular strain of the virus, coronavirus, SARS coronavirus 2, is very, very small. It has been a few months. You know that the virus first appeared in China in the end of December. So we do not know as to how this virus would behave, whether it would mutate. God forbid it does, then there would be, other. So there are so many ifs and buts before we can take a decision.
All right.
And international travel is still under, it's for all practical purposes, it is out of the question. So issuance of passports and travel, those are decisions which can be taken as we, come to that stage.
All right, we're joined in by two callers. We'll take the callers together. We're joined in by Mr. Surya Prakash from Delhi, and also Mr. Srikanth from Delhi. Good afternoon, both of you. Mr. Surya Prakash, please ask the question first.
सूर्य प्रकाश बोल रहा हूँ मैडम
जी बोलिए, पूछिए अपना सवाल।
ये सवाल ये है कि मैं रोहिणी में रहता हूँ, ड्यूटी करने में जाता हूँ नई दिल्ली एरिया में, फायर डिपार्टमेंट में नौकरी करता हूँ। हेलो
जी प्लीज पूछिए अपना सवाल, रिपीट कीजिए।
फायर डिपार्टमेंट नौकरी करता हूँ और डेली हमें सैनिटाइज करने जाना पड़ता है, हमें कितना खतरा है उसमें मैडम?
All right, we have a corona warrior amongst us, and he says that he is there in Rohini, and he steps out of his home every day to sanitize. Added to this, I would also take the next caller along with him. Mr. Srikanth is joining us from Delhi. Mr. Srikanth, please ask the question.
मैडम परसों में ना एकदम से मेरी हालत खराब हो गई, ठंड लग के बुखार आने लग गया
जी।
उसके बाद क्या कहते हैं, थोड़ा सा नोजल नाक भी बहने लग गई। अब कल फिर नाइट में मेरे को और बुखार आने लग गया। अब मेरी पेंडलियां दर्द कर रही है। मैं जो 10 साल में कभी बीमार भी नहीं पड़ा, अब 2 डेज से लगातार मेरे को ये तकलीफ हो रही है। ये कहीं कोरोना तो?
Alright, Dr. Agarwal, do you take that question?
सेकेंड वाला पहले जवाब दूंगी कि आपको हेल्पलाइन कांटेक्ट करके आपके घर के पास में जो भी फैसिलिटी है वहां जाके चेक करवाना चाहिए जरूर। फर्स्ट वाला सैनिटेशन वर्कर का कि आपको पर्सनल प्रोटेक्टिव गियर मिलता होगा, वो आपको ध्यान देना है कि उसको कैसे पहनना है और कैसे निकालना है, उन चीज़ों का ध्यान देना है। स्टेप्स आपको सब समझाए होंगे, उसके साथ भी आते हैं। और बाकी आपको हैंड हाइजीन, सोशल डिस्टेंसिंग, ये सब चीज़ें मेंटेन करके रखनी है। तो जब भी काम पर जा रहे हैं, क्योंकि ये सब फ्रंट लाइन वर्कर्स का रिस्क जनरल पॉपुलेशन से हमारा ज़्यादा है, क्योंकि ब्रीच हो सकती है। तो वो चीज़ों का हमको ध्यान रखना है कि जो भी हम लोग पर्सनल प्रोटेक्टिव गियर में, सब चीज़ों का, कि उसमें ब्रीच ना हो। मास्क जो आप पहनते हैं उसका कांटेक्ट प्रॉपर हो, सीलिंग उसकी प्रॉपर हो, ताकि उसके थ्रू वायरस नहीं जाए। तो ये चीज़ें आपको ध्यान रखनी है। बाकी एज फ्रंट लाइन वॉरियर्स थोड़ा सा रिस्क जनरल पॉपुलेशन से ज़्यादा तो है ही, वो हमको एक्सेप्ट करना है।
Yes, so we'll have to be careful, and you being Corona warrior, Mr. Surya Prakash, will have to take extra precautions. From here, we go across to Dr. Gupta. Dr. Gupta, just a while back, we had Dr. Sen explain to us what is plasma therapy. Now, this question is coming in, which the person asks, what is the success rate of plasma therapy in the United States? Can it be implemented in India on a large scale, like in New York?
I think plasma therapy is one of the exciting treatment modalities that we're looking at. At our institution at Mount Sinai Hospital, we have an active plasma infusion, convalescent plasma infusion protocol in place. You know, one of the challenges with trying to understand the disease and what treatment works is to have patients treated in a systematic way. If you give the same patient 3 different treatments, one of which could be plasma, it's very hard to determine which of those 3 treatments has been effective in improving the patient's condition. I think at this point we have seen some success with plasma infusion. And I think, as we go forward, we will see and understand better which patients will benefit from this and which patients with corona might not benefit from it. And I think that's a crucial point to understand, that just like any other disease, different patients with the same disease respond differently to different treatments. And what we are trying to do, and it's still early days in this, is to understand which patients with COVID-19 infection respond to plasma and what to expect in terms of the response.
All right, so on that note, we come to the end of this special program, Tracking COVID-19 Doctors Speak, wherein we took questions from our viewers. The viewers asked questions on the phone numbers which were flashed on the screens. Also, they put us questions on our other social media platforms. When we talk of the precautions, all our precautions, maintaining personal hygiene, keeping yourself isolated, staying at home are the best precautions which could be taken to ensure that you keep yourselves and your near and dear ones safe. This has been highlighted time and again by the government, by the Prime Minister himself when he talked of Man Ki Baat program today. And with that, we come to the end of this special show. Thank you so much, all our panelists, for joining us this afternoon on Tracking COVID-19 Doctors Speak. Thank you so much. That's it in this edition of COVID-19 Doctors Speak. Thank you for watching. Namaskar.
दुनिया में कई काम बड़े मुश्किल हैं, जैसे कि चंद मिनटों में चांद पर पहुंचना, टूथपेस्ट में पेस्ट को वापस डालना। और भैया एक काम है जो है बेहद आसान। अरे भाई वही आधार कार्ड में अपना एड्रेस अपडेट करना। इसके लिए बस आपको UIDAI की वेबसाइट पे जाना है, अपना आधार नंबर डालकर OTP जनरेट करना है, फिर फॉर्म में OTP डालकर अपडेट एड्रेस कर कंफर्म करना है, और लो हो गया आपका आधार में एड्रेस अपडेट।
केंद्र सरकार ने शर्तों के साथ ग्रामीण इलाकों में मॉल्स को छोड़कर लगभग सभी दुकानें खोलने की दी अनुमति। दुकानों में 50% कर्मचारी ही रहेंगे काम। प्रदेश के अन्य